started, and here is the question. Right. If you have read and understood, kindly begin your examination.
Okay. After entering the room, I'll wash my hands
Yes.
and introduce myself to the patient, confirm the name and age of the patient.
Good.
Then I'll take permission from the patient to examine him, his nervous system, his reflexes, by looking, feeling, and moving patient's arms and legs. I'll also examine the patient in a standing, sitting, and lying down position. For that, I'll take the permission. I'll first ask the patient to stand up, and to test the Romberg sign, I'll ask the patient to put the feet together with hands by the side and eyes closed. And also, I saw that the patient should not fall. I'll stand nearby to protect him, and I'll see if the Romberg sign is positive or not. Then I'll request the patient to take a few steps. I'll see the gate and ask to turn around and again walk on the heel first and then walk on the toes. And later on, I'll ask the patient to walk with heel to toe walk in tandem and in a straight line. Then I'll ask the patient to sit down. And to test the staccato speech, I'll ask the patient to say a few words like British Constitution, and you'll see if there is a staccato speech present or not. Next, I'll ask the patient to keep his head steady, and then I'll test the extraocular movement for the nystagmus in the form of H shape, and ask the patient to follow my index finger from one eye at a time. And then I'll request the patient to open his mouth and say ah, and also ask to cough. By this, I'll assess the glossopharyngeal and vagus nerve. Then I'll ask the patient to shrug the shoulder against my hand's resistance. This will assess the spinal accessory nerve. And I'll ask the patient to stick out the tongue. And then I'll ask him to push inside the cheek against my finger, which I will push from outside. And this will assess the hypoglossal nerve of the patient. After that, I'll ask the patient if he has any pain in the upper limb and he need any analgesics, and then I'll take the permission for the moment. First, I'll see the tone of the upper limb. For that, I'll support the patient's arm and ask him to leave it completely relaxed and leave it free. Then I'll move the arm passively through the full range and see if there is any resistance or it is smoothly moving. I'll do it on the both sides. Then I'll ask for the tapping, and bilaterally I'll see the reflexes, including the biceps, triceps, and supinator. Then I'll go for the pronator drift test. First, I'll ask the patient to close the eyes and place the arms outstretched forward, palm facing up. Now I'll see if there is any upward drifts of either side of the arm. And after that, while the patient's eyes are still closed, I will keep the arms in that position and press it downward to see the rebound phenomenon. After that, I'll do the finger to nose test. I'll ask the patient to touch his nose with the tip of index finger, and then touch my fingertip, which I will move randomly like a moving target. and this will assess the coordination.
What do you expect there to be? Yes.
There will be in coordination in case of any cerebral pathology. This will be in coordination. There will be inability to do this test, ma'am.
And there will be intentional tremors. Yes.
And there will be presence of intentional tremor also.
Yes.
Then I'll see the dysdiadochokinesia. I'll ask the patient to tap the palm of one hand with the back of the another hand in alternatively by rapidly, so that a patient will be unable to do it in case of cerebellar ataxia.
Good.
And then I'll request the patient to lie down, and I'll ask for the exposure of the both legs.
Yes.
And then I'll ask if there is any pain in the limb before moving the leg. And first I'll see the tone of the lower limb, each one alternatively. First I'll do the leg roll, and after rolling, if there is a foot will flop independently while rolling. And I'll also do the same on the another side. Then I'll do the leg lift by briskly lifting the leg of the bed at the knee joint, and I'll see if the heel is remain in contact with the bed or not, or it is lifted. Then I'll do the reflexes of knee and ankle on both sides. And then to see the coordination of lower limb, I'll ask the patient for heel to shin movement. First, I'll ask the patient to bend the right knee and touch the left knee with the right ankle, and slowly move the right heel down the left shin slowly, and I'll see if the patient can do it or not. I'll ask to repeat the same on the opposite side. After that, then I'll thank the patient and help him to get dressed and ask if he need any other help, and then I wash my hand.
Very good, excellent. Can you please summarize your case now?
To complete my examination, I like to do the complete neurological examination of cranial nerves and upper and lower limbs. Yes. So today I have examined 49-year-old male who had presented to psychiatrist with some hoarding disorder. And after examination, I noticed there is a broad-based gait in the stance phase. And there is unsteadiness in tandem gait, and the patient cannot able to do the tandem gait. There is no Romberg sign is negative, and presence of staccato speech, and on nystagmus is not present. On upper limb examination, there is positive pronator drift sign. Also, there is presence of rebound phenomenon and dysdiadochokinesia.
So, what are your differential diagnosis?
My differential diagnosis is there is cerebellar ataxia due to some cerebellar pathology like posterior fossa tumor.
Yes.
And there are other differential diagnoses, maybe some cerebellar metastasis, either from lung or breast carcinoma, or there may be some head trauma or cerebrovascular accident. There may be multiple sclerosis or like a transient ischemic attack.
Good. How should this patient be managed?
After complete clinical examination, I would like to do the investigation with first plain X-ray.
Yes.
It may show some calcification in the at the site of the tumor, and I'll then go for MRI brain with gadolinium enhancement.
Okay.
I'll also can do CT scan, which can be used better to use post-operatively, and CT full body to detect the primary tumors if it is a case of metastasis, and also can do the guided biopsy of the tumor.
Very good. And what should be the treatment for this patient that you can offer?
After complete diagnosis, we'll discuss in a multidisciplinary team, and then we'll discuss, and finally the treatment will be the excision of the tumor.
Okay, good. Thank you so much.
Thank you, ma'am.
Right, good. just 20 seconds extra, but then you will get this much time in exam because COVID days are going and they are giving 1 minute extra. So, all right, good.
Have I left anything? Actually, I don't know. Dr. Isfaq, please.
Maybe not in that order, but I was following. You did cover everything, hopefully.
Yes, ma'am. We did
Yeah.
cover everything.
Yeah. Yeah. Yeah, you think so as well, right? But then order is not that much important as long as you cover the whole thing and you tell the findings at the end. What are they saying?
Yeah.
Yes, they are happy.
Yeah.
Good, excellent.